Hey guys, we're here again to demonstrate the MAT test. Many of you guys probably don't know what the MAT test is. It was originally created to guide floor nurses to see how well their patients could get up and ambulate to the bathroom safely independently. Here in the ICU, our patients are not going to be ambulating to the bathroom independently, but we are going to be using the MAT test down here to just assess overall mobility of our patients and to identify potential fall risks. The first things first, before we get the test going, is we want to make sure the bed's in our very low position. Make sure the wheels are locked, obviously, and make sure that the patient always has non-slip footwear on. Those are essential in starting the test. And we also need a gait belt here. Anytime we're going to be getting our patients up, we really should be using a gait belt to not only give them more stability, but also help us in the event that the patient were going to fall. We could guide them down. So the first part of the test, all we do is simply ask the patient, hey, try to get to the side of the bed on your own. You just see how well they can do it on their own. Excellent. So Mike was able to do this on his own. Hypothetically, if he were not to be able to do this, at this point in the game, we could actually give him a little bit of assistance to help get him to the side of the bed, and that's okay. The next part of the MAT test is actually having Mike try to clear the bed on his own up to a standing position. So first things first, we're going to get our trusty gait belt on. Okay. We want to make sure Mike's feet are flat on the ground, so go ahead and scoot a little forward, a little more. And the first thing we want to do is just assess, see how well Mike can push off the bed and clear his bottom off the bed. So go ahead and try that, big guy. Excellent. Back down. You want to try to make sure the patient can clear about 1 inch. If the patient can't do this and they can't get off the bed, they deem that they failed the MAT test, and the test automatically stops and the patient's returned back to bed. If they can do this, we move to the next step. Next step is having Mike actually go from a sitting position to a standing position on his own. Encourage him to use the bed to push off of, and he can also use an assist device like a walker or a cane if need be. So Mike, go ahead and try to push off the bed. Excellent. And then have him return back down to bed. We're going to do this twice. One more time. Push up. Perfect. So Mike has passed the sit to stand portion of the exam. Hypothetically, if he would have failed this portion, wasn't able to stand, he would fail the test altogether, and we would bring him back to bed. So because he's passed, we're going to move on. The next point in the game, we're going to have him do some marching in place. So go ahead and do a couple marches in place. Excellent. A lot of patients can't do this. A lot of patients got a lot of edema, they got heavy legs, they're weak from sitting around in bed, physical therapy hasn't seen them, so they can't do this. In Mike's case, he can, so we're going to move on. The next and last portion of the exam is where you go from, we do a leg advancement. So go ahead and take your right leg and push it forward and back towards base. Good. Now do it with your left. Excellent. Mike passed this. He did excellent. So therefore, we can document that he has passed this exam, requires minimal assist to get to a chair, and we can safely get him out of bed as long as we have a gait belt. If Mike hadn't passed any of these, like I said before, he would fail, and we would need to use our assistive devices and more manpower to get him up. And we're able to document this in Cerner under MAT and SCOOT test pass and fail. And that's it. That concludes the test.